business. It is, however, separate and independent. It is a fund for all of South Africa. When we held our first press briefing a few weeks ago, we had yet to set up a board and formal governance structures. I am pleased today to say that we now not only have an independent board of 12 members that exemplifies the robust governance this important institution requires, but that we have also appointed a competent and passionate interim CEO to drive our activities and coordinate the actions towards a common goal. With more than 20 years in the financial services sector, Nomkhita Ngweni will next outline her role and the fund's approach to fulfilling its mandate, as well as highlighting the progress of our various activities over recent weeks. I would now like to hand over to Nomkhita. Thank you.
Thank you very much, Gloria, for that kind introduction. And good morning to colleagues from the media and other stakeholders that are on this call. I must say that at the outset, it is quite humbling and gratifying privilege to be able to serve and contribute as part of this collective that you are going to hear from today on this very, very important mission for our country. Certainly, it's my first time interacting with all of you in this capacity, having been in the role of interim CEO of the fund for the past 2 weeks. I'd like to take this opportunity to update you on how we have progressed in, firstly, building capacity, building the appropriate processes and systems within the fund to ensure the fulfillment of our operational activities that absolutely can be measured against the highest and strictest levels of governance, to engender the very important principles of accountability and transparency to all our stakeholders. I'd also want to share with you some of our immediate priorities and how we are approaching them. But before I do that, I think it's important to once again re-emphasize why the fund was created and what its mandate is. As Gloria has just alluded to in her opening remarks, the Solidarity Fund has a very, very clear mandate to support the national health response, to contribute to the resultant humanitarian effort that is related to the COVID-19 pandemic, and to mobilize South Africans to drive a united response to change behaviors in an effort to flatten the curve. We are indeed unique in that the Solidarity Fund has created that single platform for all South Africans to bring together their collective resources to serve as a rapid response vehicle, to have immediate impact in the areas we have identified in the primary phase of this pandemic as requiring focus and intervention. And so as an independent and agile organization, we have been able to make and activate meaningful interventions to support and augment those provided by the state and other organs of society in a very, very short space of time. If you reflect on the updates today and on the progress that the fund has made, it is hard to believe that this is an organization that is only 1 month old. As my colleagues and I unpack the various areas of activity, you will see that a lot of meaningful decisions have been taken to bolster our resilience against the onslaught of the COVID-19 pandemic. Starting from an operational perspective, we have formalized various structures that will help us and enable us to function in a manner that delivers against our goals. Across our main effort areas of health, fundraising, and humanitarian effort and the Solidarity Campaign, we have accountable executives and the team members that Gloria has alluded to that support them, or those accountable executives, and are working very hard in dedication to their country as they all offer their services and talents on a pro bono basis. We have also formalized the operational enablement areas of finance, operations, and disbursements to support the organization. In addition to the operating model, we have the oversight of 3 board subcommittees, that is the Fundraising Subcommittee, the Audit and Risk and Compliance Subcommittee, and the Disbursements Subcommittee, who are there to ensure that we have the appropriate policies, controls, and risk frameworks in place that enable us to account at absolutely each step of the way. PwC has been appointed as our external auditor, also providing their services on a pro bono basis. In the 1 month of our existence, we have received 2.6 billion in pledges, and I would like to echo the gratitude from our chairman and thank South Africans for their generosity and really showcasing that we can indeed come together to make a difference, especially in times of crisis. And of course, whilst the amount raised is commendable, especially given the time period, and sounds like a lot, I think it's important to note that against the scale of the challenges that we face, it is still a drop in the ocean. And thus, given the limited resources we have, it is imperative that when we do act, we need to make sure that the impact is immediate and can be sustained. An example of that is in our health response activities, where we have made and executed swiftly in the procurement at scale of personal protective equipment that is very much needed to support our first line of defense, which is our health care workers, and also in supporting our increased capacity to facilitate testing. Johnny Bloomberg will give more detail around this as part of this briefing a little bit later. My other colleagues, Paul and Nicola, will also share more details around fundraising initiatives in particular and humanitarian response as it relates to the food crisis. But before they do that, let me share one of the other most important aspects of what we are trying to achieve as part of our efforts. One of the key catalysts in our ability to flatten the curve and combat the spread of COVID-19 is anchored in our ability to create awareness and educating one another to influence changes in behavior that can help in slowing down the spread of this virus. And to this effect, we have launched a solidarity campaign, which is flighting currently on all major media platforms. This campaign seeks to inspire and mobilize South Africans to act, both individually and collectively, to flatten the curve and to support those who are affected. In doing so, we hope to create truly a sense of unity in action. As part of the campaign, and also in seeking to ensure that we are able to reach all South Africans, we have partnered with 15 radio stations that reach all of our provinces, where we are flighting educational segments in 11 languages, supported by clinicians and experts, as well as identifiable role models to communicate the important messages of social distancing, washing our hands, etc., in an effort to improve the adoption rate and hence contribute towards flattening the curve. I'm sure we can all say that this is pretty important, especially in the rural areas of our country. This campaign is worth millions. But because the Solidarity Fund is a pro bono organization, we have worked together with creative agencies that have given of their time and skills, but also importantly, we have partnered with various media owners and organizations in broader South Africa that have generously donated the media booking slots and various billboard platforms for us to be able to flight this campaign. This is yet another example of what is possible if we all work together. As we think about our priorities going forward, we know that the coronavirus situation and its social and economic impact is constantly evolving in different ways across many countries around the globe. So whilst our focus is currently on these areas of health, humanitarian response, and unifying the nation, as the impact of the pandemic unfolds, we will continue to reevaluate the situation to ensure that our interventions remain relevant and, most importantly, impactful. A principle and commitment we live by as a fund is to ensure that there is transparency on all of our activities. And so by the end of this week, our website will be relaunched, and this will be the central portal that would contain detailed information and daily updated information around things like pledges received, how we have allocated those resources, and the tracking and reporting of the impact we are having, as we owe that to all of the South Africans that have donated to the fund. And we welcome constant engagement on how we can continuously improve this engagement portal. Thus, with transparency and continuous updates in mind, let me now hand you over to my colleague Paul, who will give you details on the sources of our fundraising efforts, and he will be followed by Jonathan, who will give color on the excellent work on the procurement of the health equipment, and lastly, Nicola, who will share the humanitarian relief intervention we have deployed in the aim to assist in the combating the food crisis. Over to you, Paul.
Thank you, Nomkhita, and good morning to you all. We've seen an almost unprecedented response by all donors across individuals, corporates, and charitable foundations to the call by our President to stand together to drive a united response to the pandemic. Everyone is getting involved. Our fundraising program has reached out to a wide array of corporates, foundations, and other donor groups in a coordinated way. But it's also the contribution of individuals, no matter how big or small, that echoes the fund's solidarity aim of inspiring and mobilizing South Africans to act, individually and collectively, to flatten the curve and support those who are affected. The fund was launched a month ago with 150 million rand of seed capital donated by the state. It now stands at 2.6 billion rand. Of this amount, just around 1.6 billion has already been received in the fund's bank account. By way of more detail, around 1,000 businesses have made donations to the fund. But importantly, we are particularly grateful to more than 75,000 individuals who have contributed amounts ranging from as low as 2 rand to over 1 million rand. Every amount and every pledge is valuable to us and highly appreciated. It's also inspiring to see so many individuals and public figures having pledged a portion of their salaries in the coming months. This is a growing amount and an incredible act of solidarity. As President Ramaphosa reflected this week, taxpayers who donate to the Solidarity Fund will be able to claim a deduction from their taxable income. It's important to clarify that the Solidarity Fund is not administering all donations made by some high-profile families and foundations. They have set up their own relief efforts and they are being administered separately. In line with our principles of transparency, from next week, we'll be able to track pledges and see who is donating to the Solidarity Fund on our website. And with that, I'd like to hand over to Johnny.
thanks for attending this press conference with us. I will give you a quick update now on the work of the Solidarity Fund in relation to the health response. I think, as you're all aware, it's become very clear from the global experience that if this virus is allowed to spread unchecked in our country, it has the potential to result in truly catastrophic human, social, and economic costs. And our foremost priority now as a society, led by our president and the government, is to intensify the health interventions that are needed to contain and to delay the spread of the virus, and therefore to allow time for our health system to prepare and to save lives. And the Solidarity Fund's focus in this context has been to support the government and broader national efforts to prepare our public and private healthcare systems for the increased burden that will result from the pandemic, and to ensure that the critical equipment and emergency supplies that are required are available in the country when they're needed. As Nomkita said a little while ago, the Solidarity Fund should be seen as a rapid response vehicle that focuses on highly targeted, impactful interventions. And in the first few weeks of operation, I'm very pleased to report that the fund has approved a massive $1.1 billion in funding for the health sector. This is focused largely on the purchase of personal protective equipment that will protect frontline healthcare workers, as well as other critical equipment for the health system, such as test kits and ventilators and others. Just to talk to you very briefly about process, we have seen, and globally you'll be aware that there's been a significant shortage of PPE for use by healthcare workers, and market prices have increased because the whole world has been competing for these items. They are mainly manufactured in China, and just as Europe and the US were reaching the peaks of their epidemics, South Africa was starting to scale up. And so it was very critical that the Solidarity Fund was able to step in and work quickly to bring in these much-needed supplies as quickly as possible. We've been working closely on this with the National Command Center, as well as the health work streams of Business for South Africa and the Department of Health to determine the critical needs for the health system resulting from the pandemic. And the procurement priorities have therefore been determined by national government and by Business for South Africa's health work stream. And those two elements are working very closely together. We needed to make sure that our carefully targeted high-impact procurement was in areas where government and other players were going to take action but were not yet ready to take action, and in other cases where certain products were simply outside the capacity of other entities to procure at very short notice. So we have been working very closely, as I say, with Business for South Africa. They are operating the procurement engine, if you like. We've been working specifically on acquiring PPE required by healthcare frontline workers, including gloves, masks, goggles, face shields, respirators like the N95 masks, and various other items of equipment. It's been a very complex process. Firstly, these products have detailed technical specifications. You need different types of products for different kinds of healthcare workers, for example, community health workers compared to frontline workers in a hospital. It needed a complex process of verifying and validating the suppliers as well as the quality of the equipment, and of course, importantly, price negotiation. So an entire procurement engine has been built within the Business for South Africa stream, and the Solidarity Fund's been working very closely with that to make sure that purchases are placed appropriately. Just to give you a quick update on progress, in the first week, the fund approved 100 million rands worth of procurement, demonstrating a high speed of responsiveness. Since then, we've continued to move with agility and speed to procure additional equipment. Thus far, orders to the value of 420 million rand have been placed. A further 192 million orders are being processed as we speak. To give you a bit of detail about what those orders are purchasing, in terms of personal protective equipment, about 21 million masks have been purchased, and hundreds of thousands of hand sanitizers, gowns, goggles, gloves, etc. as well. Some of these are already in the country. The rest will be arriving over the next 1 to 3 weeks, and then there'll be a continuous procurement cycle. All of these items have been rigorously checked for quality, and we're very confident that the quality will meet true global standards. In addition, the fund has provided funding to the National Health Laboratory Service, allowing the NHLS to purchase test kits for another 400,000 tests to be done over the next weeks. That's also critical. And the fund has funded the procurement of 200 ventilators, which will be on their way to the country very soon. I'm also pleased to tell you that there's a very strong emphasis on local manufacturing. The fund is working closely with Business for South Africa, the Department of Trade and Industry, and Small Business Development, supported by both the private sector and various higher education and scientific technology units of government. This is to ramp up quickly the local manufacturing, both of low-tech items such as masks and gloves and gowns, but also high-tech items such as ventilators. And we're pleased that Denel and others are repurposing their manufacturing capabilities to be able to provide equipment like ventilators. The fund would obviously welcome reliable and sustainable domestic production of critical equipment, given the huge global demand, and this could lead to a long-term sustainable industry emerging in our country. Of course, our primary objective at this stage is to secure the procurement of the most critical interventions as part of the fight against flattening the curve. We have been fortunate to have the benefit of learning from the experience of other countries ahead of us, and this has informed our local responses. We believe that tracking and tracing and testing is a critical element, hence the importance of supporting our National Health Laboratory Service. By acting as quickly as it has, we believe the Solidarity Fund has already and can continue to make a very positive difference in protecting frontline health workers, bringing in critical equipment, and shoring up our defences in the coming months. We'll be providing regular updates as to the progress of orders for PPE in terms of their progression along the supply chain. So thank you very much for the opportunity. I'll now hand over to my colleague Nicola Golombek.
Trends in Africa, Central and South America, and Eastern Europe.
I'm going to share
most countries are still in the early stages of their epidemics. And some that were affected early in the pandemic are now starting to see a resurgence in cases.
Across all 9 provinces,
Make no mistake,
remote areas.
We have a long way to go.
We've been overwhelmed by requests
this virus
for
will be with us
and we know
for a long
these are
time.
Extremely difficult times for South Africans.
There is no question that stay-at-home orders and other physical distancing measures have successfully suppressed transmission
for the most
in many
vulnerable
countries.
communities across the country.
But this virus remains extremely dangerous.
Complementing and augmenting the work of government.